Hello again. This video is in reference to my post, How Hip is Your Knee Pain? What I'd like to do is I'd like to talk a little bit more about some of the terminology that I used in my post. Let's talk about the positioning, the structural position of your knee. Okay, we've got varus as well as valgus. Okay, varus, as you can see, I'm pretty bow-legged. Okay, being bow-legged is a varus position of the knee. It's a kind of a curved out angle of my tibias being down below as well as my femurs up above. Okay, so bow-legged is varus, whereas valgus is actually just the opposite. Valgus is a turning in motion of the knee. So if you're knock-kneed, okay, I'm kind of really exaggerating it, that's a valgus position of the knee. All right. The article talks about a dynamic valgus angle. Okay, so we're a dynamic valgus position. We typically see that with more functional activity. So if I'm going to step up on a step, the normal way of stepping up, of course, is to keep that knee over your foot. So as I raise my body weight up forward, I shouldn't have any, I guess, mal-positioning, abnormal positioning of my knee joint. Okay? As people step up that have really weak hips, they're going to step up, and this is going to happen. We call that a dynamic valgus angle. Okay, it's the angle brought on because of weakness up in the hip abductors over here, as well as the glutes over there. Okay, so as I step up, people that have a dysfunction will do this, and then their whole body curves, and they come up. Okay. The other thing that can happen too, kind of catch my hips here too, is a Trendelenburg. A Trendelenburg is when, if I stand on one leg, what can happen is the opposite hip can drop. So as people are walking, if they have a Trendelenburg at any particular moment, as they're swinging through the opposite side, they're bearing weight on the involved side, and this will happen as they swing through. That same thing can happen as they step up on a stair. Okay, so same thing. You might see the combination of a dynamic valgus angle as well as soon as I bear weight on it, my hip drops in the side and come up. They're always doing this torquing thing. So not only can this create a potential knee pain situation, but foot pain, hip pain, as well as back pain, because everything is being torqued as you step up in that abnormal position. The other thing, this can also happen functionally with lunging. So as you go to lunge forward, same thing. Let's actually do a back lunge here. As you go to do a back lunge, knee should stay over my foot. Hip should stay relatively in the same line as my knee and my foot. Okay, boom. If there's that, if the dynamic valgus angle kicks in again, same sort of thing happens. This goes in this way because of weakness here and weakness in the glutes. Okay, so it's really important as you're doing these exercises in the gym or with your trainer or at home to make sure that you're not creating that dynamic valgus angle. Okay, so Trendelenburg, dynamic valgus angle. Now let's actually talk about a couple exercises you can do. These are really basic, just something to maybe have you get started with at home prior to, of course, coming to OrthoWell Physical Therapy to kind of advance these exercises, because there's a lot of different exercises we can do to maximize hip abductor weakness as well as gluteal weakness. Okay, so pretty ordinary, common exercise out there is just, it's actually the left side, is actually a resisted hip abduction. Okay, so you go to lay into your side, okay, making sure that you're not losing your core stability. You don't want to have an extended or a really flexed spine as you do this. So core should be engaged, pulling that navel in, keeping your abdominals engaged, and I go to raise. I go up and back with my leg. And hold 5 seconds, and then back down. Okay, so engage the core, and back up. 2, 3, 4, 5, back down. Okay? Simple exercise to get started on for your glutes, for people that are really weak, could just simply be bridges. Okay, another very common physical therapy exercise out there. Okay, same sort of thing. I'm engaging my core, abdominals in, contracting my glutes first, making sure all that's good and tight and engaged before I go to raise, and I go to raise up. Okay, same sort of thing. I'm really squeezing these hard to activate them as much as I can. Same thing, hold 5 seconds, and then back down. Okay, last one. Well, I guess next one, to make this exercise actually even harder, same sort of thing. Engaging my core, glutes are tight, and I'm going to raise the leg in combo with the weight during the bridge. So I'm actually isolating one glute versus the other. Same thing, 5-second hold, and then back down. Okay? Then you could do a dynamic exercise as well. You could take and place a little TheraBand loop. You could take a piece of, just rubber band, the TheraBand that's out there, and you could loop it around your leg as well. These loops are actually kind of nice. They're pretty short money, so it's just a couple bucks for this stuff. So around your knees, okay? So same thing, I'm activating my abductors as I'm about to perform a squat. Okay, so abductors are out, okay? Butt goes out, weight stays down through my heels, knees don't pass the toes, and the feet stay flat on the floor. Okay, so hold 5 seconds, and then back up. Okay, same sort of thing. Butt out, and then back up. Okay. As far as the reps go, anywhere between 8 to 12 repetitions when it comes to strengthening. By the time you get to that 8th or that 12th rep, you should be tired. It should be as though your muscles have been worked out. It shouldn't be that these exercises are easy by the time you get to that last rep. And then as things get easier, you start adding more weight. Or you can actually start holding dumbbells as you do the squat. Okay? So why don't you start with that, and let us know if you need our help going further. Thanks a lot.